let's talk about the pandemic, because the numbers that we're getting on the U.S. case front continuing to improve. U.S. daily cases now below 30,000 here for the fifth day in a row. We want to talk more about this with Dr. Hiral Tipirneni. She's an emergency medicine physician based in Phoenix, Arizona. And Dr. Tipirneni, it's great to have you back on Yahoo Finance. That number I mentioned, we continue to stay below 30,000 for 5 days in a row. Do you think we'll be able to stay below that level?
Well, thank you for having me. And yeah, I mean, I think, look, we have made incredible progress with our vaccination rollout. And that's really the key, right? Because vaccinated humans are essentially not a breeding ground for the virus. The virus cannot replicate to the level it needs to. It is not transmitted to other people. Essentially, it's a dead end. So as we continue to, make sure all the states are achieving the highest level of vaccination rates possible. Right now, we're at, I believe, 40% of all Americans are fully vaccinated, and more than 50% have at least one dose. And obviously that's higher in the higher age groups. So that being said, I think we can absolutely continue to bring those numbers down. Whether we'll bring it to absolute zero, that's to be seen. But the point is that with vaccinated people across the country at a high enough level, we don't have the ability for that virus to continue replicating, and therefore we control any rate of infection.
Doctor, this talk about the need for a booster shot within a year of your vaccine, it seems like it's going to be complicated, or will it be? I mean, we can walk into CVS or a Walgreens and get your flu shot. Is that what we're going to be doing to get the booster shot, and just show them the card that said I got Pfizer or Moderna or whatever? Give me whatever you got.
Well, I think we're not sure exactly what that booster is going to look like and exactly when. Sort of what we've seen so far in studies is possibly sometime around 9 months after you've been immunized, you would need a booster. But studies are still being completed. And what we know is that the immune system sometimes does need a little bit of a reminder. It's essentially, sort of reintroducing that stimulation to the immune system to say, hey, we still need those antibodies. We're still at risk here. And this is something, we get right for tetanus and for all sorts of other things. We get a flu shot every year, which is a different strain, granted, but boosters are not a novel concept. So if we need it in 9 months or somewhere in that vicinity, I have no doubt that the researchers that are working on this right now will produce a viable booster. I'm sure there'll be multiple options, and it'll be very clear what the protocol is for that once we establish the absolute need for that.
So, Doctor, it sounds like things are trending in the right direction. We're talking about getting a booster shot. More and more people are getting vaccinated. The daily cases here trending in the right direction. What's your biggest worry at this point in the pandemic?
Well, we haven't achieved that level of herd immunity. And so although we are absolutely on the right track and we've made incredible progress, we aren't at that finish line yet. And as long as there are people out there that are able to be vaccinated and remain unvaccinated, remember that they are potential hosts for the virus. They are potential replicating grounds for that virus. And that means that they could potentially spread. And remember, too, we have variants that are being discovered in all sorts of, in all parts of the country and the world. And because of the presence of those variants, now, right now, we know the most prevalent variants, our vaccines are effective against them. But that's one of the risks of delaying the vaccination goals, is that we give more time for those variants to develop and therefore have a chance of variants developing, protection and being resistant to our vaccines. And that opens up a whole other challenge for us on this vaccine program. This was the largest undertaking logistically that our country has ever seen. And I think right now we're at a really good place. But if we don't complete the task at hand, and that means continuing now to get 12 to 15-year-olds vaccinated, and hopefully that age limit will come down and continue to help us get all young people vaccinated, and making sure that everyone who's able to gets a vaccine. Right. Until we achieve that, we're potentially putting ourselves at risk for those variants.
Doctor, very quickly, we keep hearing from Dr. Fauci. We keep hearing from CDC Director Dr. Walensky. Is it too much? Should there only be one voice? Because it's creating confusion, all the information they're sharing with us.
I agree. It can be very confusing, and it's a question of, who do we listen to, and it can be overwhelming, especially for, lay folks who get one snippet of news and that's all they hear. I think it would be great to sort of consolidate all those voices to one clear message, and rather than having one entity sort of clarify the other entity's messaging. That being said, I think the data is consistent. I think what Dr. Fauci and Dr. Walensky have reiterated since last week's announcement is that people who are vaccinated are essentially safe to go indoors and outdoors in those settings. They can opt out of a mask. Nothing is mandatory that you have to remove your mask. People are still welcome to wear it if they're comfortable. But remember that we're relying on everybody to get vaccinated that can get vaccinated. And that's ultimately the goal, to make sure that we can entirely return to some state of normalcy.
Dr. Hiral Tipirneni, thanks so much. Always great to speak with you here.